For more on this story, let's bring in our correspondent in London, Bénédicte Paviot. Bénédicte, what are some of the reasons being given by those striking, and why are these all happening at the same time?
Well, it does feel like they're happening at the same time. The rail strikes have been actually going on since June, July. So those are the longest and really problematic. At times, 1 in 5 trains. That's the case again today. Why are they happening? Well, you've got inflation running close to 11%. You've got wages simply not keeping up, and you've got a public sector, whether it is indeed train workers, postal workers, lecturers in universities, ambulance men, driving instructors. The list just goes on. And the first ever nurses' strike, which we covered all day yesterday, and they having jobs. Some of them are having to go to food banks. That's certainly the case of some of the nurses, for example, that we were speaking to yesterday. So it's not just about modernizing, for example, the railways and therefore reducing staff, which the railway workers say, well, this endangers actually the life of passengers. We can't do that. So it really feels, in all but name, at times like a general strike. It is problematic. And the problem is that what they're being offered at the moment is 4% or 5%, which in real terms, therefore, would be a 6 or 7% or more pay cut. And that really is a mood of the government and the Prime Minister, Rishi Sunak, and his various ministers, whether it's the health minister, the transport minister, saying we can't afford a bigger pay offer than that. So no end in sight, and really a lot of deadlocks and more strikes, whether it is today or in the days to come, into January, with more strikes set to be announced.
So, Bénédicte, is daily life going to be able to continue? I mean, understandably, people get worried, especially when life-saving services such as hospitals and firefighters are involved.
They do, and let's be clear, as we made very clear yesterday. First, we should say that the nurses' strike, for example, was in England, Wales, and in Northern Ireland, I should say, not in Scotland, where a pay offer has actually been is being looked at and possibly accepted there. But what is made clear by the unions, is that actually all emergency work, accident and emergency, life-preserving is what it's called, continues. What has been disrupted is tens of thousands of appointments. Some, indeed, we thought had been ring-fenced like cancer, but some appointments did not go ahead yesterday. Checkups, also planned operations, and whether it's a hip operation or knee operation, the waiting lists are already so long, 1 year, 2 years, that people, of course, across the nation, the United Kingdom, becoming very anxious about that, despite those reassurances. Postal strikes? Well, people have been told if you haven't posted your Christmas card by now, it may not arrive before Christmas. So all these, and if there's 1 in 5 trains, so 20% running, really, please don't travel is what a lot of people are being asked. So a very grim prospect when life is so tough. And what I haven't yet mentioned is the cost to the British economy. It seems that the government estimates that the rail strikes alone will cost the British economy £1.7 billion. And what we've got when people can't travel, and this whole cost of living, is that, for example, businesses, be they big, be they medium-sized, or be they small, are not getting the customers because people can't get about. So there's the cost of living effect, and there's also the disruption effect. So really problematic. And I think the stiff upper lip and the can-do attitude is very much required. For the moment, according to polls, there is real support, for example, for the nurses' strike, considerable support still for the rail strike. But that, if no resolution is found and there's that continued deadlock, we'll have to look at whether the public continues to support those strikes, even if they understand the difficulties, the economic challenges that all these workers face. So difficult times here.
Bénédicte Paviot in London, sounds like we'll be checking in with you a lot over the next month. Thank you.